In a meeting held at St. Vianney's Hall, Nativity School, Mawkyrwat, the Chief Minister of Meghalaya, Shri Conrad Kongal Sangma, had interaction session with community leaders, religious leaders, SSG members, Anganwadi, ASHA, and field functionaries on leadership role in fighting against COVID-19. While speaking about the role and function of the block war room in the district, Shri Ferdinand Basan, BDO Mawkyrwat CNRD block, informed that the district has achieved only 37% of the residents regarding COVID-19 vaccination, even though the vaccination teams have gone to each and every village for vaccination. The Chief Minister appreciated the suggestions and clarified the doubts raised by the members. He also urged the citizens of Southwest Khas Hills district to get vaccinated and strictly adhere to the protocols in order to overcome the pandemic and avoid lockdown. He added that the government had never forced people to get vaccinated, but have urged people to do so in order to protect others. While addressing the plight of the ASHA workers, Shri Conrad Kongal Sangma said that the government really appreciated and recognized their self-sacrifice and hard work. Therefore, the government has proposed a fixed amount of 2,000 rupees per month, and during the COVID-19 pandemic, an additional amount of 1,000 rupees per month besides other allowances will be given to the ASHA workers.
But I want to tell you my personal perspective on COVID. Number one, COVID has disrupted everything from your personal lives to governance, to the taxes we collect, to the implementation of projects that we do. So it has been a very, very difficult time for the government also. In the last 1.5 years, we have not been able to do the kind of development works that we had planned.
Is regarding the COVID situation that we are facing. I am appealing on behalf of the government to all of you that we must not be hesitant for vaccination. I want to tell you that we have lost 1,000 people in our state. 1,000 people have died in our state. And out of these 1,000 people, 96 to 97% of them had not taken vaccination. That means 950 people had not taken even a single shot. A lot of people are wondering and questioning that even after taking vaccine, we are still becoming positive. It is happening. People are getting positive even after vaccination. But the seriousness of the ailment is not there. Anybody who has taken vaccine, they are not being hospitalized. They may have slight cough, slight cold, slight fever, but the people who are not taking vaccination are having cold, cough, fever, and they are in hospital. So that is the difference. So please don't believe rumors that people are giving. You need to save your life and you need to save your family's life. So therefore I urge all of you, we have not come to force. Nobody can force anybody. So there's no question of forcing you to take vaccination. But we are appealing you to please take vaccination so that you can protect yourself and also your family members.
During the interactive session, Father Venky Friding, Parish Priest of Nativity Parish, Mawkyrwat, raised several issues.
It is also important to give an official and expert explanation regarding the following skeptical information to people. 1. Regarding testing results, why there is no symptom when one is tested positive, and many have taken the test results as fake and manipulated. Secondly, the testing device. It is a question of many whether this testing device can accurately give or detect and show the presence of COVID in the person, or is it only showing the presence of antibodies? Thirdly, selective attack. Now this COVID looks very selective. It selects who the time gap of the vaccination between the first dose and the second dose. How does one justify the extension of this time gap? And how long will the second dose vaccine be effective? Do we need a third dose? An official clarification is also called as to who can be vaccinated and who cannot be vaccinated. Because last year, a pregnant lady, a breastfeeding lady, a person with comorbidities, and other classified categories cannot be vaccinated. However, the same people can be vaccinated now.
Shri Sampath Kumar, IAS, Principal Secretary of Health and Family Welfare, he spoke about the nature of COVID-19 and how this novel virus keeps mutating from time to time and informed that in Meghalaya, it is the Delta variant that affected people. In a lucid way, Shri Sampath Kumar IAS, along with a doctor from DHS, clarified the question raised and doubts expressed by the field warriors.
The COVID. Some questions are related to the COVID, the nature of COVID. Basically, whether someone without any symptoms can cause any problem. That's a very important question. Whether COVID selectively infects people. So the very intelligent question. Whether COVID selectively, I think I thank Father who has raised this question. I just want to tell you, COVID is a new disease. Entire world is facing. Please understand this. COVID is a new disease. Scientists, medical experts, they are trying to understand the disease. So last year we didn't have much information, but today we have a lot of information. We got a lot of knowledge we have gained. So as per the data which has been which has come by measuring crores of people, not one person, like millions of people who have taken vaccine, this data has been arrived at. If 1,000 people, in a village or in a block, let's say, the 1,000 people who have not taken vaccine, this COVID, the disease, I want to tell you the nature is first of all, it's invisible. You can't see it. Because if I remove the mask, if I speak, if I have COVID virus, I can potentially transmit to other person. So even asymptomatic person can transmit to others. Asymptomatic means I don't have any fever, I don't have any symptoms, but somewhere I picked up that virus from someone, I can potentially transmit to somebody. The chances of getting infection by COVID, if you take vaccine, is imagine, if you take vaccine, it's very less. That means 20% only. Okay? That's one. Number two, those who got infected, people ask who gets symptoms. Only as far as current data, at least in our state, around 40% are shown as symptomatic people. Okay, 40%. Symptoms means they will have some fever, cough, other issues would be there. So then 10% of the people who are infected are getting hospitalized. This is the cause of concern. This is the cause of concern. Suppose, imagine how many beds are there in your hospital. So you have to understand that. If many people get infected, it's a cause of concern. That's why, to reduce the spread, the district administration goes for containment measures. Because this COVID spreads when there is a movement, when there is an intermingling of people, when people start talking to each other, start dining each other without mask, this problem can arise. The COVID can be manifested in two phases. That's why it's called COVID has a biphasic nature. Biphasic nature is two phases. The first phase is like any other fever. Somebody asked the difference between COVID and normal flu. It's just like a normal flu only. There is no difference at all. For symptomatic people also, initially you will not find much difference. That is the initial period. That's what phase 1. This COVID, because this is a virus, it actually, more people it meets, it actually mutates more. Mutates means it changes. It gets more strength. So, in India, that's why in India we got more mutant variant currently. Because India has large population and the population is intermingling, so we have got a Delta variant. In Meghalaya, recent sample shows that 100% Delta variant. It's a very important thing. 100% Delta variant. That means we have highly infectious virus. So what should we do? We have essentially 3 things to do. Please understand. 3 things. Only 3 things to do. If all of us do this one, we can kill and isolate the virus in no time. First thing is that we all should get vaccinated. Because vaccination is found to be the most effective solution. Initially, in any research, in any scientific research, the trial is not done on children and the pregnant women. That's why initially it was not given to the pregnant women.
I also wanted to appeal to all these self-help groups and the village organizations, that we need to really work on this, health care, because health is fundamental for even livelihoods. So we need to really work together, especially, we need to get everyone vaccinated at the earliest, because, there is not much time that we have left, because people are predicting a 3rd wave. So we really require to bring that, mobilize everyone for vaccination. That is one thing. And also we also have a plan that for health also, to promote health, we also wanted to promote a kind of an institutional model like a village health councils. A pilot is being done. So that also, we would like to active participation of the communities in this.
It increased quantity test. Lana the test the virus, negative test the antibodies. The unique test given the virus free. Because antibodies ni habang halik test ng sabat. Nile lumbakas na. Kaya balik antibodies kung lumbakan, yung mabalik ng paglaman niya.